Hi, my breast is very saggy. It's dropped that my nipples are nearly at the same level as my belly button. I don't want my breast lifted. I'd like to have implants fit in and the excess of the skin removed. I'm interested in implants that are very sturdy, not looking naturally. I want them to look oh, like those of many adult film actresses, shall we say. Would that be possible, and how much would that cost, please? Okay, so we'll answer the question. Oh, is that hair? Oh, it's on that side. Yeah, we have a hair issue. I'll go straight on. I'll be all right. So, yes, so we have I have replied to that with costs and what have you. But it's an interesting question because it's the whole issue of breasts, implants, and lifts. Broadly speaking, the thing about a breast implant is it makes the breast big. Lift is that it lift and it makes the shape better. So an implant makes it bigger, a lift makes the shape better. So the thing is to say, look, what's the problem? Is it shape or is it size? Or is it size and shape? So this patient is saying the breast is very saggy, their nipples are nearly at the same level as their belly button. Whoa. So that is sounding like a lift to me. But it's an interesting point because this patient is saying they want their implants to look, their breasts to look not natural at all, and presumably bigger. If there is you can do a similar sort of thing to a lift with implants. So what implants do, or in terms when you have saggy breasts, what you need is you got too much skin. And there's two ways you can address that skin. You can either cut it out, which is doing a lift, or you can fill the volume with an implant to sort of take up the slack skin. And now a lot of people, like this patient, doesn't want a lift. To be honest, no one wants a lift, really. If you asked anyone, do they want a lift? No one wants a lift if they can avoid a lift, because a lift gives scarring, it gives complications, you have to move the nipple, and there's all sorts of problems associated potentially with a lift. So no one really wants one if they can avoid it. So often people say, look, can I avoid a lift? And I understand why they say that. Now, sometimes you can avoid a lift if you have got a bit of a sag to your breasts by taking up that slack skin with an implant. But it needs to be quite a big implant, number one. So if you don't want to be much bigger and you just want the shape of your breast better and you might happy being a little bit bigger but not much, that's not sounding like a good prospect. I'll be like, you know what? I think it's a lift. It's the shape, it's the sagginess you really need addressed. So it's a lift you really need. Whether or not you put an implant in is optional, sort of thing. You can combine an implant with a lift, but it does increase the complications. So if you're going to use a small implant, you'd be like, it's increasing your complication rate. You might want to just have a lift to start off with and see if you're happy with the volume. If you're not, you can have implants at a later date. Similarly, if you're like, I do not want the scars of a lift, I really don't want it, like this patient saying here, I don't want the scars of a lift, totally understand it. You could sometimes do implants without doing a lift, but two big butts. Two big butts. Big butts. I like big butts. So two big butts is number one. Big butt is has to be a big implant. So if you don't want to be much bigger, it might not do the trick because the implant is doing the same job as what the lift would have done. It's taking up the slack skin. So that's the one big butt. It has to be a big implant. The other big butt is that it is not going to be as good as doing a lift. If you need a lift, if your breast is sitting low, the best way to address that is with a lift. So you cannot get, it's a compromise. If you say, look, I don't want the scars of lift, I don't want the complications of lift, fair enough, I understand that. No one does. But if you don't have the scars and complications of a lift, and you're going to use implants, you're compromising the result and you may not get as good a result. You may well get a good result in a bra. You may look okay in a bra, but out of a bra, your nipples might sit low, your breasts might sit low, and worst case, your implants will be up here and your breasts will be falling off it. I've got to say, if So this is something you really need to do with a consultation, because it's hard to do with just like talking in words, saying, "Oh, my nipple, my breasts are the same like the size, same level of my belly button." But if your nipples are the same level of the belly button, I suspect it's not. It may well not be a goer. So some people, it's like not a goer for implants. Implants are only a goer if you're borderline. If you're borderline for a lift, you could say, okay, you're borderline for a lift. You want a big volume increase. You could just have implants on their own, but your nipples would still sit low. Your breast would be bigger, but the shape of your breast, if you're not happy with the position of your nipples, it will be the same. The position of your nipples will be the same, and you'd have to put the implants in to sit with the breast. So you have to put the implants in low when you do the surgery. It's difficult to, it's a fraught surgery to get right, because you have to put the implants with the breasts if your breasts are sitting low. And if you don't get the implants low enough, sitting low enough with the breasts, you end up with breasts, implants up here, breasts down there, oblong shaped breast. Doesn't look good. So it is a tricky one. I'm not sure if I've explained that properly, but it's a tricky one when people are borderline for a lifted implant. So you might be an option for a implants only. It sounds like you're not if your nipples are truly at the level of your belly button. But if your nipples aren't quite that low and you want a big implant, you might have an option of just having implants. But you'd have to accept the limitations of that, which would mean the shape would maybe not be quite as nice as we would like. And sometimes when you do these cases, sometimes you need to do a lift later on as a second stage and say, look, it just doesn't look right. I need to do a lift. Sometimes you just say, look, you know what, I've avoided the scars. I look great in clothes. I look great in a bra. Out of a bra, you know what, I wish my nipple was a little bit higher. That's often the case. I just wish it's a little bit higher. But, we cannot lift the nipple if we're not making a scar around the nipple. So if you're just putting implants in, you can't lift the nipple. So it's interesting that they're saying they don't want to look natural. They want to look like a adult film actress. And so that actually is in favor of the implant only, because that would be a big, maybe an extra high profile, big implant. If you want that sort of look, which is actually in favor if you've got too much skin and sort of borderline for a lift. So that's actually quite a good candidate. As I say, if you want a small implant, it's just not going to take up that slack skin.